Hi everyone, my name is Dr. Rabab Elhassan. I'm a medical registrar who works in Dublin, Ireland. I'm performing this talk about diabetes and macrovascular complications of diabetes as part of my individual assignments for the Diabetes Diploma course of South Wales University. It mainly belongs to Module 6. So starting, I'm going to start with understanding of diabetes. So what's diabetes? Diabetes mellitus class is metabolism disorder. Metabolism means the way our bodies use digested food for energy and fuel. Most of what we eat is broken down into glucose. Glucose is basically a form of sugar in milk. It is the principal source of fuel for our bodies. When our food is digested, the glucose makes its way into our bloodstream. Our cells use the glucose for energy and growth. However, glucose comes into our cells without insulin being present. And insulin is basically a hormone which is secreted by the pancreas. After eating, the pancreas automatically releases an adequate quantity of insulin that move the glucose present in the blood into the cells. As soon as glucose enters the cells, blood glucose levels drop. So basically we need insulin to enable glucose to enter the cells. So what's diabetes? Diabetes happens actually when the body does not produce enough insulin for proper function, or when the cells in the body do not react to insulin, and that's what we call it, insulin resistance. So approximately around 90% of all cases of diabetes worldwide are type 2 diabetes. Some people may be able to control their type 2 diabetes symptoms roughly by losing some weight, following a healthy diet, doing plenty of exercise, and monitoring their blood glucose levels. However, generally speaking, type 2 diabetes is typically a progressive disease. What does that mean? It means that it can gradually worsen, and the patient can probably end up having to take more medications or probably end up taking insulin. So talking about diabetes, we need to talk what's the risk of type 2 diabetes. Type 2 diabetes is related mainly to obesity and being overweight. Overweight and obese people have much higher risk of developing type 2 diabetes compared to those with healthy body weight. People with a lot of visceral fat, also known as central obesity, belly fat, or abdominal obesity, are especially at risk of type 2 diabetes. Being overweight and obese causes the body to release some sort of chemicals that can destabilize the body's cardiovascular and metabolic system. So, talking about this, we can mention that even drinking just 1 can of non-diet soda per day can raise our risk of developing type 2 diabetes by 22%, which is like really something to think about. Complications of type 2 diabetes, talking about the complications, we can divide the complication into two, the macrovascular and the microvascular. The macrovascular is due to damage of small blood vessels, while the microvascular is due to damage of larger blood vessels. Microvascular complications include damage to the eyes, we call it retinopathy, leading to blindness, or damage to the kidneys, we call it nephropathy, leading to renal failure, and damage to nerves, causing neuropathy, leading to impotence and diabetic foot disorders, which include severe infections leading to amputations. I'm going to focus in my talk actually on the macrovascular complications. The macrovascular complications include cardiovascular disease such as heart attacks, strokes, and insufficiency of blood flow to the legs. There is evidence from large randomized controlled trials, which are like big trials, that good metabolic control in both type 1 and type 2 diabetes, good control can delay the onset of the complications. So that's something we can achieve really. So cardiovascular disease and diabetes mellitus as part of macrovascular complications. We'll talk about the heart disease. So heart disease might affect people with diabetes if their condition is not managed well for a prolonged period of time. That can be in a form of coronary heart disease, which is characterized by narrowing of blood vessels supplying the heart muscles. It is recognized to be the cause of death for around 8% of people with diabetes. However, it is believed that these heart attacks are largely preventable. People with type 2 diabetes are more likely to be at risk from heart attacks, strokes, and also high blood pressure. They can also be at risk for vascular problems such as poor circulation to the legs and feet. And this poor circulation together with nerve damage can lead to decreased sensation and predispose patients to ulcers. So, talking about the cardiovascular risk in diabetes. A report from the UK Diabetes in 2007 estimates the risk of cardiovascular disease in people with diabetes to be 5 times higher in middle-aged men and 8 times higher in women with diabetes, which is like really, something. So talking about types of cardiovascular disease with diabetes, this can include heart disease, heart failure, or stroke. Heart disease results when blood circulating to the heart is slowed or stopped because of a blocked vessel, while heart failure occurs when the heart loses its ability to effectively pump blood to different parts of the body, while stroke can result when blood flow to the brain is blocked, causing probably weakness or some other neurological symptoms and signs. So if we want to look for an answer for the question, what's the cause of heart disease in diabetes? Looking closely into that, hyperglycemia, which is high blood sugars, which is like a feature of diabetes basically, in combination with the presence of free fatty acids, which are like particles of fat in the blood, can change the makeup of blood vessels, and it can lead to cardiovascular disease. The lining of the blood vessels may become more thick, and this in turn can impair blood flow and lead to cardiovascular disease. So due to all of this, heart problems and possibility of stroke can occur in diabetic patients. So the other question would be like, what symptoms can identify heart disease in diabetic patients? Common symptoms of heart disease include pain in the chest, shortness of breath, irregular heartbeats, and swelling of the ankles. And however, the symptoms can vary from one individual to another. And to assess the risk of heart disease, a simple test at a start is usually done, which is like an ECG, which can show some changes that point towards like heart disease. Another question is, what are the risk factors for cardiovascular disease? So the risk factors for cardiovascular disease include like family history of early onset heart disease, also older age. Both of these are strong risk factors for cardiovascular disease. Other common risk factors include high blood pressure, high cholesterol, obesity, and smoking, and all are like manageable factors. Persons with diabetes are found to be 2 to 4 times more likely than others to develop cardiovascular disease. And actually, cardiovascular disease is the main and the leading cause of death in type 2 diabetes. So how can we protect our heart from cardiovascular disease? We, like anyone, can reduce its risk today by making the following changes, like quitting smoking, losing weight, eating healthy diet. You can always ask your dietitian for advice about that. Performing exercise is important. We advise regular exercise about 3 times per week, and maybe in the form of brisk walking. Also controlling the blood sugar and improving the cholesterol. Setting an appropriate HbA1c goal. What's HbA1c? It's like it's a measure of the glucose bound to hemoglobin. in the blood, it gives you an estimate of the blood sugar over the past 3 months. So usually, like everyone with diabetes can have his or her own goal for HbA1c, and this is something to be discussed with your doctor. And it's important to work towards achieving this goal. Another complication of diabetes and part of macrovascular complications of diabetes is stroke. So people with diabetes are more than 2 times, they have more than 2 times increased risk of stroke. It's mainly ischemic stroke that they can get. It's not surprising. So when you consider that many of the risk factors of stroke and diabetes correlate together, like high blood pressure, obesity, and high cholesterol. So how we can prevent stroke? Fortunately, there are several healthy changes that you can make maybe to lower your risk of stroke. For example, control your blood glucose, since studies have shown that stroke may occur less often in patients with better blood glucose control. Also, lowering your blood pressure, treating high blood pressure can lower your risk of stroke dramatically as well. Treating high cholesterol, as your healthcare provider or your doctor can help you with lowering the bad cholesterol by using some medications, and of course lifestyle changes. Stopping smoking is an important thing as well that you can do. And sometimes aspirin therapy can be started for patients. Since many patients with diabetes may benefit from aspirin, you can ask your doctor if aspirin therapy is right for you. And we need to know also that stroke occurs when there is disruption of blood flow to the brain. And there are basically 2 main types of stroke: hemorrhagic stroke and ischemic stroke. Diabetic patients are more prone to ischemic strokes. Another macrovascular complication that we need to talk about is peripheral vascular disease. About a third of all people with diabetes have blood vessels that are narrowed, and this can prevent blood from circulating in the body and reaching the peripheral extremities. So decreased blood supply to extremities can take place, and that occur mainly in the legs. So symptoms that you can get is like painful legs, particularly in the calves with walking, which is also known as claudication. The pain that you feel in your legs is caused when narrowed artery prevents blood flow to your muscles, limiting the oxygen and nutrients delivery to these muscles. And this usually happens when you move your legs. So on its own, claudication is not like an emergency situation. However, people are advised to contact their doctors, since this can be an early warning sign of peripheral vascular disease. So what's the treatment of peripheral vascular disease? So depending on how severe the condition, your healthcare provider can advise you and recommend any treatment, starting from lifestyle changes, exercise, and diet, to proper treatment plan that can include as well quitting smoking, as I mentioned before, regular exercise of the foot and leg, and also treating blood pressure, treating cholesterol with cholesterol medication, and also sometimes taking medication that can decrease your risk of having a blood clot, like aspirin. And it's always important to contact your healthcare provider right away if you notice this pain in your legs or feet when you walk. However, as I said, it's not an emergency situation, but it could be a sign of peripheral vascular disease. Also maintaining, as I said, a healthy lifestyle is an important factor in treatment and prevention of peripheral vascular disease. I want to talk as well about another serious complication of diabetes, which is development of foot ulcers. About a quarter of all people with diabetes will develop foot ulcer at some point in their lives. And the cuts, which often start small, can quickly turn into a bigger infection, bigger ulcer. And diabetic foot ulcers are considered the leading cause of foot amputations among diabetic patients, so it's serious enough. What protective measure can be taken for that? So the main thing would be like to wear a proper footwear. Properly fitting shoes are the number one way to prevent foot ulcers. And maybe other simple measures include avoiding flip-flops, avoiding high heels or stiff shoes, and avoiding as well open-toed shoes can be of help. Choosing a shoe that have plenty of toe room and smooth inner lining and sole thick enough to prevent puncture wound in case if you step over a nail or something that can injure you, and also wearing socks to prevent cuts. Diabetics are advised to wear shoes indoors and outdoors as well, and always try to look at your feet, inspect your feet. This should happen like actually on a daily basis. And if you are not able to do that for some reason, you can always ask a family member or a caretaker to check them for you. It's very important. And if you notice any callus, blister, drainage, or any abnormal area of redness, you can always contact your healthcare provider. So when do you think you will be at risk of foot ulcer? So there are some factors which make you more at risk. So if you feel that your shoes rub the wrong way, or you wear poorly fitting shoes, if you think that you have a foot deformity, or if you have blood pressure, these are all of these are factors that can increase your risk of getting a foot ulcer. Having a previous foot ulcer as well can put you on the high risk category for another foot ulcer. And if you often walk with barefoot, this can as well increase your risk of getting a foot ulcer. If you have decreased sensation of your feet due to neuropathy, nerve damage, also this can increase your risk of having a foot ulcer. If you have poor eyesight, which can prevent you from checking your feet properly, or if you are overweight with diabetic eye disease, this as well can cause some difficulties with checking your feet, and also maybe put you a little bit on the higher risk of getting diabetic foot ulcer. Another modifiable factor is smoking, which can increase the risk of diabetic foot ulcer. So always, if you're a smoker, think of quitting. And at the end, I would say, remember that as a diabetic, you can always take control of your life by controlling your diabetes. And controlling your diabetes is a target that is achievable and is worth all the efforts. And hopefully this will enable you to live a healthy, productive life with maximum potentials. Thank you very much.